The medical terminology of obstetrics. Obstetrics is a specialty that is concerned with the mother and fetus during pregnancy, childbirth, and the immediate postpartum period. Obstetricians study obstetrics and gynecology and are referred to as OB/GYN obstetrics and gynecology. Fertilization. Fertilization occurs when a sperm and an oocyte, or an egg, combine. Because each of these reproductive cells is a haploid cell containing half of the genetic material needed to form a human being, their combined forms a diploid cell. This new single cell is called a zygote. Most of the time, a woman releases a single cell during an ovulation cycle. In approximately 1% of ovulation cycles, 2 eggs are released and both are fertilized. 2 zygotes form, implant, and develop, resulting in the birth of dizygotic or fraternal twins. Because dizygotic twins develop from 2 eggs fertilized by 2 sperm, they are no more identical than siblings born at different times. Less common, 1 zygote can divide into 2 separate offspring during early development. This results in the birth of monozygotic or identical twins. Full-term pregnancy lasts approximately 270 days, which is approximately 38.5 weeks, from conception to birth. Because it is easier to remember the first day of the last menstrual period, or LMP, than to estimate the date of conception, obstetricians set the due date as 284 days, which is approximately 40.5 weeks, from the last menstrual period. This assumes that conception occurred on day 14 of the woman's cycle, which is usually a good approximation. The 40 weeks of an average pregnancy are usually discussed in terms of 3 trimesters, each approximately 13 weeks. During the 2nd and 3rd trimesters, the pre-pregnancy uterus is about the size of a fist and grows dramatically to contain the fetus, causing a number of anatomical changes in the mother. The stages of childbirth. The process of childbirth can be divided into 3 stages: cervical dilation, expulsion of the newborn, and the afterbirth. For a birth to occur, the cervix must dilate fully to 10 centimeters in diameter, wide enough to deliver the newborn's head. The dilation stage is the longest stage of labor and typically takes 6 to 12 hours. However, it varies widely and may take minutes, hours, or days, depending in part on whether the mother has given birth before. In each subsequent labor, this stage tends to be shorter. Homeostasis in the newborn, the Apgar Score. In the minutes following birth, a newborn must undergo dramatic system changes to be able to survive outside the womb. An obstetrician, midwife, or nurse can estimate how well a newborn is doing by obtaining an Apgar score. The Apgar score was introduced in 1952 by the anesthesiologist Dr. Virginia Apgar as a method to assess the effects on the newborn of anesthesia given to the laboring mother. Healthcare providers now use it to assess the general well-being of the newborn, whether or not analgesics or anesthetics were used. 5 criteria: skin color, heart rate, reflex, muscle tone, and respiration are assessed, and each criterion is assigned a score of 0, 1, or 2. Scores are taken at 1 minute after birth and again at 5 minutes after birth. Each time scores are taken, the 5 scores are added together. High scores out of a possible 10 indicate the baby has made the transition from the womb well, whereas lower scores indicate that the baby may be in distress. The technique for determining an Apgar score is quick and easy, painless for the newborn, and does not require any instruments except for a stethoscope. A convenient way to remember the 5 scoring criteria is to apply the mnemonic Apgar: appearance, skin color, pulse, heart rate, grimace, reflex, activity or muscle tone, and respiration. Of the 5 Apgar criteria, heart rate and respiration are the most critical. Poor scores for either of these measurements may indicate the need for immediate medical attention to resuscitate or stabilize the newborn. In general, any score lower than 7 at the 5-minute mark indicates that medical assistance may be needed. A total score below 5 indicates an emergency situation. Normally, a newborn will get an intermediate score of 1 for some of the Apgar criteria and will progress to a 2 by the 5-minute assessment, and scores of 8 or above are normal. In vitro fertilization, or IVF. IVF, which stands for in vitro fertilization, is assisted reproductive technology. In vitro, which is in Latin translate to in glass, refers to a procedure that takes place outside of the body. There are many different indications for IVF. For example, a woman may produce normal eggs, but the eggs cannot reach the uterus because the uterine tubes are blocked or otherwise compromised. A man may have a low sperm count, low sperm motility, sperm with unusually high percentage of morphological abnormalities, or sperm that are incapable of penetrating the zona pellucida of an egg. Obstetric vocabulary. Abortion is termination of a pregnancy before the fetus is viable. The AFP is an alpha fetoprotein test. It is a maternal blood test to detect potential fetal abnormalities such as neural tube defects or multiple pregnancies. The AFP is taken between 14 and 19 weeks gestation. Amenorrhea is the absence of the flow of menstruation or no period. It is one of the first signs of pregnancy or menopause. Amniocentesis is surgical puncture to remove a small amount of amniotic fluid through a needle via the abdomen. The fluid is tested for any potential fetal abnormalities. Artificial insemination, a process where the semen is introduced into the vagina by mechanical means, thus called artificial. Breech, the position of the fetus is feet first. Ideally, the position of the fetus should be head first for a safer delivery. Cesarean Section, or C-section, is delivery of the fetus through an abdominal incision. Cephalopelvic disproportion, a condition where the infant's head is larger than the pelvic outlet and therefore will require a C-section. A cerclage. A cerclage is a suture inserted into the cervix to prevent dilation and prevention of miscarriage. The suture is removed when the fetus is full term and allows the vaginal delivery to proceed. Cephalic version, pertaining to turning of the head. This procedure is done on the fetus when they are in the head down position. Chorionic villus sampling. A small piece of placenta is taken and tested to determine potential for birth defects. D&C, or dilation and curettage. A procedure where the cervix is dilated or widened with a curette, a sharp instrument. is used to remove the lining of the uterus. This procedure is conducted when there is abnormal bleeding from the uterus and also to remove any products of conception, for example, following an incomplete miscarriage or abortion. Eclampsia, a very serious condition in pregnancy with hypertension. Patients are at high risk of coma, convulsions, and even death. Ectopic pregnancy. The embryo implants in any place but the inner endouterine lining. Episiotomy is a procedure where an incision is made to widen the vaginal opening to prevent ripping or tearing of the perineum during delivery. Gestation, the process of being pregnant. Gestational diabetes, the condition or developing diabetes during pregnancy. The newborn tend to be large at delivery and the mother is monitored closely for weight gain and glucose testing. The goal is to balance the sugars so the fetus is not too large for vaginal delivery. Gestational hypertension, a condition where there is an increase in blood pressure during pregnancy. Blood pressure is monitored closely during pregnancy for the safety of the mother and infant. Hyperemesis, excessive vomiting during pregnancy. Hyperemesis gravidarum. Hyperemesis can occur with any pregnant woman, even a woman who miscarries. Often these women may require hospitalization for fluid and electrolyte intake. Induction, the process of bringing on or starting labor. This may be done with a membrane sweep or through the use of IV oxytocin. In vitro fertilization, or IVF, a process where the ova is fertilized outside the body and then implanted into the uterus. Meconium staining, when the fetus defecates while in utero. The first defecation is called meconium. It is black and sticky. If the infant inhales the meconium upon delivery or through the birth canal, the meconium can be aspirated into the lungs and stick to the lung tissue. The newborn will have problem breathing and go into distress. The newborn's umbilical cord will be stained a brownish color. Natal, pertaining to born. Neonatal, pertaining to the newborn. For example, a neonatal record or neonatal unit. Non-stress tests. Tests conducted on the pregnant women to assess fetal heart rate. Nulli gravida, a woman who has never been pregnant. An obstetrician, a person who specializes in the study of obstetrics and gynecology. They are referred to as OBGYN, obstetrics and gynecology. Oligohydramnios is a condition where there is a minimal amniotic fluid within the placental sac. Too little fluid can restrict the fetus from movement and growth. Oocyte is a female gamete. Oxytocia is a rapid birth. Placenta abruptio or abruptio placenta. This occurs when the placenta prematurely becomes detached from the uterine wall. This is a medical emergency and requires an immediate C-section to save both the woman and infant's lives. The infant will not be getting oxygen from the mother, and the mother may hemorrhage.